You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Hi, Ashley. How are you?
And how are you?
Good. Thanks for coming over.
Absolutely. Thank you for having me.
You're someone who is a little bit of a different, I would say, perspective in healthcare. You're a physician liaison. What does that
Yes.
mean?
So I essentially am the voice of the clinic outside in the community, and I represent not only our physicians, but all of our staff. And I am able to get across any type of awareness that we want to get out there, or also if we want to be a part of the community, I kind of help with what would be the best way to be a part of our community and help them with their journey, especially in oncology and being able to help them within their cancer journey.
Got it. So you work for a company that specializes in cancer treatment, correct?
Correct.
Yeah. So can you tell me a little bit more about, what the company does? How did you get to work for them? And like, what do you want to accomplish with this?
So, CCare, we are the largest private oncology practice in California, and we have everything under our roof as far as radiation therapy, chemotherapy, medical oncologists. We have breast surgeons, gynecologic surgeon. I mean, we run the gamut of everything that has to do with cancer care. We recently acquired California Urology, so our urology group, and then we also acquired a radiology site. Central Valley Women's Imaging. So we want to extend those services and kind of make it easier for the patient if they have to have any type of urology services or cancer services as well.
I see. So you're the marketing agent for them,
So
basically.
yes, I feel like I wear so many hats. So yes, marketing, I work with our marketing team. We were just acquired through Cardinal Health, and we are part of their oncology, community oncology practice line, which is Navista. And so I'm able to work with a marketing team, and I kind of let them know, hey, this is what I need when I am trying to educate either the community as far as like patients are concerned, families, caregivers, but then also what education can I get out there to primary care physicians or, people that need that information and try to steer them in which way they want to go as far as with their treatment.
You wear so many hats, but you need to know so many things because you work in so many different specialties that I feel like if you don't know how things are working, you can advertise them. You can make connections with the public. You can advise, the people who need services, where to go. How do you accomplish this? Like
So
you're not a physician, but you need to know basically everything what they're doing.
you have to be always a student, and I'm always wanting to learn new things. I'm always trying to study up on terminology. I love listening to our physicians speak to patients or to peers and kind of get a hold of the treatment. And like you said, I am not a physician by any means, but I'm able to hold a conversation, and I'm able to at least be able to explain to the community what we do, how we do it. And I think the biggest thing for me is just always being a student of what you're practicing in, whether it's with insurances, because we have to know insurances and contracts, and then we're also with treatments and different types of treatments that are available out there. And then also, um, I think too, looking at the patient journey, and for me, figuring out my why with it and putting myself kind of in their shoes, it just motivates me even more to learn and to educate myself, all things oncology, hematology, and now urology. And I kind of have a little bit of a background in radiology because I did work with a radiology group prior to CCare. So I had my toe in the water a little bit when it comes to healthcare. But just always being a student, always keeping up with like on LinkedIn, and I'm signed up on a lot of like health related topics. I like to keep myself informed. And then always just kind of talking to the physicians, hey, what's going on that's new? What is something that's interesting to you? And just kind of hearing what's important to them. And then I take it on, and then I can be able to be a better representative of C Care for the community.
I feel like you can make a company being more successful or not? I mean, your role is kind of a decisive in how the practice goes and is seen by the patients.
Right.
What do you need in your education and your mindset to accomplish this? Like, what do you think the best way to become a physician liaison is?
For me, I think grit has gotten me very far in my career. I mean, like I said, prior to C-Care, I worked in a radiology clinic. They have 3 different locations with all kinds of modalities. And I started at front desk and worked my way up to authorizations, got to know the insurance world a little bit. And then when an opportunity came up for a marketing position, I mean, I just said yes to any opportunity that would come my way. And eventually had a conversation with, HR at C-Care, and they were interested in what I had to offer.
Mhm.
And so then making the leap over there, and I've been with C-Care for a little over 3 years now. And I am so passionate about them and what they stand for. And I'm just very proud to work for them and to work for the doctors that I work for and the leadership team. It helps with that motivation because they see my vision and they are very encouraging and supportive because my heart is really in the community space. I really want to help people and I like to hear their stories and what can we do as a practice to make their journey more complete.
So let me understand something for the listeners too. Like when let's say a patient needs care, what is the best approach you have with them in, kind of get to introduce them to your services? What options do they have? How do you approach this? What's your like model of business?
Absolutely. So I think a lot of it is where the insurance lies. I know for our practice, we take a lot of insurances. So I always go back to you have a choice as long as your insurance is allowing you to make that choice. And I always tell people try different opinions from different physicians until you feel like you found the one that's going to be right with your journey. Because, as you know, there's different personalities and different treatment methods, maybe. But I say to patients, just educate yourself as much as you can. Don't be afraid to ask those questions. And um, I always say do 2 to 3 opinions to see which one fits for you best. And so I'm not trying to sell them on anything other than this is what we look like for your treatment journey. And if this is something that you're interested in, we want to support you. But we are very supportive of everybody in the Central Valley. And so I would say just going out there and helping people, I think that in turn kind of you build relationships and then from there, people can give their recommendations as well because I feel like a lot of family or friends opinions matter to people as well. So it's just trying to be a good person and trying to get our community together and hopefully we would be in their thought process to have their treatment journey.
So is this something that you go out and try to outreach to the community and patients, or is it something that you wait for them to come to you and get advice?
No, I go out into the community. I like to do a lot of events like this Saturday. I'll be doing a women's cancer walk, but all are invited, partnering with a local 501(c)(3) Art of Life Foundation. So we're going to be partnering together. So I like to do those kind of events as far as patient facing. And I also do like a survivorship event. In June is Survivorship Awareness Month. So might do it a little bit earlier in the year because it gets pretty hot here in Fresno. But I like to do these kind of outreach opportunities for people to feel empowered and to support one another. But then I also like to do education as well. I like to get our physicians out into the community to educate either peer to peer on the latest that's going on in oncology or, doctor to patient if they have any questions or if they, that way they can ask questions and get their information as well.
I understand it's easier for you to reach out to patients and bring them to your practice or expose them to what the practice does. But how do you approach the other way around, reaching out to your doctors and say, hey, can you join me in this event? Or can you go out and, talk about this topic with the community? How does that relationship work?
You know, it takes time to build relationship with your physicians, and once you get the trust, it's very easy. I mean, if I say I know one of our doctors, Dr. Hasib, I asked if he could do like a GI education for the public because that's something that we need to be talking about and working with local gastroenterologists and getting together for an education night. And for him, he was like, of course, I'll do it. And so we just compare schedules and get it on the books. But I am very fortunate because the physicians I work for are on board and they are willing to provide that education, especially if it's like an awareness month. I think that we lead with that. We lead with wanting to educate everybody in our community because we want them to make the decision that's right for them. And we want them to stay informed so that if they see any abnormality, don't question it, go to your doctor, get your screenings. And then if for whatever reasons you need further treatment, then, we can be the ones to take care of you.
Yeah. I want to go back to your situation a little bit and your mindset for a second. And I'm sure to be successful in this line of business, it's a matter of mastering the communication, the relationships with the patient, like person-to-person approach. But I'm sure there was something in your career so far that really didn't work out, like something that you were stunned by and kind of disappointed and kind of moved on from that and learned. Any example?
Well, definitely the communication aspect, that is huge for my role. I love interpersonal communications and I also love to present as well to, audiences if needed. But as far as like any challenges, I've been pretty good about pivoting. I think that's the biggest thing is looking at your market, seeing where there's a need and pivoting, depending on the need. And I'm trying to think of a really good example for you, and I just can't right now. I'm so sorry. But I would say I just lead with this career. I just really lead with my heart on my sleeve. And I love hearing people's stories. And I love how can I make this person feel important and empowered. And I have never had cancer, but I have had family members that have had cancer, and that is my whole world now. And so I always try to look at what their perspective is and what would be important to me if I were diagnosed with cancer. What would I want out of my treatment? And something that I'm really trying to build here in the Central Valley is that support system, not only for the patient, but for the caregiver as well. We want them to feel empowered. We want them to feel like they're being taken care of. And so that's where my mind is going all the time of, how can I make this person feel special and help them through one of the most daunting, diseases?
Yeah, obviously the diagnosis of cancer is something that, is life-changing, and I don't wish anybody to go through that. But in the same time, when they do, obviously people like you are essential to kind of guide them through this whole, I would say, more psychological journey than anything, and understand what they need to do.
Right,
Um,
absolutely.
But I mean, what do you think the biggest challenge for you is right now, like in your field? Like what is the hardest thing to do for you right now in your job?
That is a great question. What is the hardest thing? It's interesting you say that because I don't know. It's because I love what I do. So I'm trying to think of challenges. I think the biggest challenge for me is keeping up with the latest technology and latest drugs. And it's interesting because our team is actually going to be starting to pick this up again, but we're going to do like weekly education meetings of like, what are you guys hearing out in the field and what are the latest and greatest, like what, who's using what as far as like, with medical oncology and different things. And even with breast cancer, things are changing constantly, and whether it's technology or when you need to be having your screenings and so on. So I think that's a great way to tackle it, is coming together in your team and just talking about, hey, did you know about this? And again, education is huge. And so I would say that's, I guess, the hardest part is just keeping up with everything. But if you make that part of your routine, then it really isn't so much of a hardship. It's just figuring it out and knowing kind of like you said, the ins and outs of not only the clinic, but region and different things like where the pulse is, where sorry, I feel like I'm not making sense.
No, I mean, I'm thinking right now while listening to you is that this is not only a communication job. It's more of how you represent the practice in the community. And I'm thinking of keeping yourself up and like updated to all the new technologies, new medication, new treatments, is what the practice is going to look like for the community. Like if you go out there and you don't know what the latest thing is to recommend, or what the trend is, like you're fighting Dr. Google right now, because people are going to, I mean, AI is right out there. Chat GPT is like on everybody's phone,
Oh yeah.
and they can look it up right away. And if you don't have the right answers for them, you're not competitive.
As far as the information goes on recommendations, I mean, that's not really my realm. That's for me to, you go to the physicians for that. But for me, I think more of just being able to hold the conversation with the physicians and kind of talking shop with them is the biggest thing on keeping up with that education piece. And I think if you just lead with always wanting to learn, always trying to make things better, like as far as making people how they feel, that's my biggest thing. I want them to feel important and special, whether they are a patient coming into our clinic or, one of our physicians that sends their patients over to us. We want to make sure that that physician knows that their patients are being taken care of. So I think I might be more of like the heart of the company. I'm kind of like that, how do I say it? I always try to think of what I can do to make things better as far as how make people feel and supported, and especially
Mhm.
like not only the patients but the caregivers as well, because the caregiver burnout is real, and I mean the morbidity rate, sorry, of the caregiver is just it's tough on them, and
Yeah.
so trying to think of what are we missing here? What is this missing piece? Because we have these wonderfully trained physicians and we have a beautiful staff that's so supportive. What are we missing? And that's kind of what I look at too. What are we missing? And so that through seeing the patient journey, that's kind of something that I'm working with our patient navigator, and we're trying to come up with support groups and different things to try to help people in that aspect too, and give more attention to, not only the patients, but their caregivers as well.
I want to touch on a little subject um, with insurance companies. This is one of the reasons patients either don't have access to care, or when they do have access to care, there is a chance of going bankrupt because they cannot pay their bills. How do you see this subject going forward in what you're doing from your perspective? Like, this is one of the questions that probably, comes up really often in your conversations with the patient population, right? Because most of the people are concerned, like, I mean, they don't know if the insurance is going to cover that treatment or the visits or, whatever. What's their copay? How they're going to pay for it? How much do you deal with this, and what do you think this is going?
For the Central Valley here, that isn't really too much of an issue for our practice because we take most insurances. But I know in other regions, it's different to where the patient, they really don't have that choice. It, like what you're saying, is wherever is covered, if it's covered. And so as far as that goes here, I'm very fortunate because we have a lot of flexibility and we take most things. It's very rare that we don't take something. Um, but like I said, in other regions, it does kind of affect what someone in my role, where you can go and who you can talk to, and so definitely that is a major factor. But just for me, luckily, that's
Yeah,
not much of an issue.
great, great. So Ashley, what's the plan this year? What are your goals? What do you want to do with this your position? What are you dreaming of?
So continuing what I'm doing as far as that community outreach portion, continuing that, growing on that, just even with little details, like we just dedicated a bench to a patient of ours who had recently passed, but he was such an advocate for sea care. So we did a bench dedication for him, and he kind of started our rock painting. And so when people come up, they see our encouraging rocks while they come up to treatment. So, it's just those little details, right? And so I want to continue that, steam forward with that, and come up with more ways that I can collaborate with other specialties to also get that education out there, whether it's patient facing or physician facing. I would like to do more educations out in the community. And yeah, I think those are my biggest goals. Just kind of building on what I've started here so far, and then just kind of building upon that and hopefully making it bigger.
That's awesome. Um, if would be one thing that you want to do in terms of, like, if I would ask you what would be one thing that you want to ask your physicians to do to improve all this communication and make your job easier, what would that be?
To do my own conference, my own oncology conference, where we can get my physicians to speak on their specialties and then have their peers come and be able to get that education not only to them, but maybe even something patient facing as well. Maybe because I know here we have a wonderful Central California Women's Conference, and it's like 4,000 women that come to this. And so it's something that I would love to try to do in the future, both physician facing and patient facing. I think that would be kind of like my dream, is to put on something on a larger scale and get that education out there on a larger scale.
Very interesting. How do you think that's going to go with your request?
I think I'm gonna start small and then from there we can just build year after year. That's kind of what like my community outreach events have kind of done.
Yeah,
They start out very, very small, and then you just build each year, even if it's just a little bit building upon the year before. That's a win in my book.
yeah. I mean, it's not an easy thing to accomplish. I imagine that people are not very receptive maybe to this format because they have to give their own time voluntarily. It's a community basically outreach uh, out of their own time,
Right.
and they're not getting paid for this either. But I think, you know, at least you can try to do that to put a face for the community of your practice, and that's hopefully that would bring more patients, or you have more satisfaction in their treatment outcomes. Um, Yeah, if you would look back with what you know right now and what you've been through and experience and stuff, look back at yourself when you started this whole process, what kind of advice would you give to yourself?
I have really learned that this is a very subjective role. And so I'm very flexible. I, for me, um, how do I say this? Like with the marketing piece, I don't hold on really tightly. I have like an idea of what I want to do, but I'm like, how do I say this? I'm having a hard time articulating this, but I don't get offended easily, is what I'm trying to say.
I see.
I welcome opinions, and I think when I first started out, I don't know if I wanted to prove myself or what, but my feelings would get hurt if someone didn't like what I had to present, or whatever ideas I had. And now I I'm just like, okay, that's fine, and just roll with it. And so I think that I've really learned to have like a tough skin, and to not let things really weigh heavy on me, and and also to follow my gut instincts as well, because there have been times where I have second guessed myself, and then I kick myself for doing that. So, and a lot of the things that I do are on the fly. So just doing that gut instinct, rolling with it, and then also not taking things very personally.
Very nice. Thank you so much, Ashley. I
I hope I
appreciate your
said that
point of
okay.
view. And hopefully people will learn a little bit about this perspective that you have. And I think as physicians and healthcare personnel, I think we need to learn more about this aspect of how the community sees the practice and how we appear in front of the community, because in any other field, the reviews are very important, right? People look at reviews. You have TripAdvisor, you have Google reviews, you have all kinds of like reviews platforms, and people look at that. And for medical practice, it's a very individualized, subjective opinion of each practice. And I think you guys have so much to bring out to the community about your practices that could make a big difference in how people see you. Um, I hope you reach your goals. Thank you so much.
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.